Okay. All right. Welcome to Project Hospital. I'm Kareem Clemons. This is another episode. Today is Throwback Thursday, 1/10/2019. Hope everybody's having a great 2019 so far. This is OMC Cold Blue, episode 7, where we'll be doing hospital construction, admission for patients, and following Dr. Clemens and also Dr. Clemens' daughter, Karima Clemens. Okay, so let's get into Project Hospital. Okay, so right now I can tell you so far that I was unable to do construction offline, but I can tell you that I'll be doing it while I'm playing the game here and treating patients at OMC. So we're already in day 20 and we already have this much money. So yeah, I think if I'm not mistaken, let me see. I think this is actually pulling off from the last episode. All right, so let's go into the. Oh, we have a surgery going on. Oh, someone just left from surgery. Okay, so let's come down. I guess the whole factor is to get everybody out of the hospital. Before I can go ahead and activate another event, we want to try to get a lot of people out of OMC quick. Okay, so let's see what's happening, Ms. Green. Welcome to OMC. We're gonna go ahead. Okay, so we failed that. I forgot about the time. All right, so we're gonna go ahead and give you some bandage and give you some for your pain. We see that you have an open wound. We're gonna do a physical examination and an X-ray. Just staying still. Oh, she's not out of the woods either because she has this here. Let's see. Before I can switch you anywhere, you're gonna have to stay put for a minute. All right, so there's Dr. Clemens, who actually has a patient, and where's this guy at? Okay, he's up here in TC. All right, so this is what he has. Okay, Mr. Green died. Okay, it looks like Mr. Green died in ICU. Okay, the first death of this Thursday. Alright, so let me clear all this off real quick. Alright, so I'm gonna be following some patients today, and also I'm gonna be doing construction on the hospital. But instead of like having a tab open here, I'm just gonna have them down here and we'll just click on them. Okay, I believe I was following Mr. Wilson because I wanted to see what was his final diagnosis. Okay, Mr. Adam is collapsing. Cold blue, cold blue. Cold blue, cold blue. Where's he at, right here? Alright, we're gonna go ahead and give him IV, and it looks like he has a ruptured spleen, and he needs surgery. Okay, we're gonna go ahead and order these tests on him. Let's get a blood and an echo done, and then we'll come back to him. I think this is general surgery, right? It is. Okay, so let's see who else is here. You have acute renal failure. You need dialysis. Mrs. Hernandez, you need you have pancreas contusion, and you need IV. I think you're already receiving it. You are. Okay, so your satisfaction, you're getting a little bit better. Let me see how you are. You're getting better. Okay, cool. Okay, we have not found a diagnosis for you, Miss Johnson, yet. I believe all the tests has come back, or they're in the process. Let me see. In progress. So your stool test is in progress. Your blood test is in progress. So once that's done, we will find out what your possibility of your diagnosis may be. So you stand tight. You're in good hands with Dr. Moore. Okay, he's a great specialist here in general medicine. Okay, so let me see. I do want to follow her. Let's follow Miss Elizabeth Johnson. Okay, so who's this guy? Okay, Jason White. Did the names pop up? Richard Clark. You have portal vein thrombosis. All right, I think it was patient's breakfast now. Okay, so patients are getting breakfast. Okay, I'm not gonna follow you anymore. Just clear you off. Who are you? Okay, you left. Let's clear you off. And this is Dr. Clemons. Okay, so okay, that this patient left. Who was over here? Okay, who do we have here? Miss Young. Okay, we're gonna go ahead and give you emergency care for your open fracture, and then let's see what Rodriguez does. I trust my doctors to make a great call. Okay, so so we can activate any one of these. Before, I'm not gonna activate any because I want to do something real quick. Okay, my goal is the hospital mission is basically to get everybody out of the hospital before we can take anybody in. If we take anybody in at OMC, it'll be anyone from the clinical departments or anyone who is rushed in through ambulance service. Okay, so yeah, so let's get back to our construction, and I'll tell you guys what I'm gonna do. Okay, so with that being said, okay, as you notice, like I told you guys, you can make the building from here all the way to over here, okay? And just have like a little part right here for your ambulance because technically we don't have any cars. So a big parking lot doesn't really mean anything. So we can actually cover this and just have, for ambulance and have the road here. It I'm not really sure if they really need this road because it's not like the ambulance turned down this block or anything comes or whatever, but it won't let you extend. But we don't really need that. It's good to just have that there, but we can have it all the way up to here, you know? So, yeah, so what I'm going to do is eventually I'm going to bring all these offices over here, right? Bring it all the way over here and then build up and build up and build up. The last I was trying to see when I went to this right here, I had a new floor. Uh, I just didn't really understand that, so I'll just do it manually. So if I need to add an elevator over here, I believe because I looked it up, you can get the okay. There's the elevator right there. Okay, okay. So that's the elevator, and then this is the ambulance, and then these are the wall pillars and everything. Then these are the floor tiles and the wall tiles in different colors. And then delete walls. So how I did it before I put on that, when I added the foundation, the walls are automatically put up. And then we just follow these orders. So if this floor is emergency, then we would go ahead and put like the offices over here and then make a walkway down here and then like eventually we'll just put everybody on this side so we don't have to like interrupt our clinic, and then we'll just continue to do that for all the other departments and everything, and then eventually we'll have this space available and then do something because I believe our x-ray is on top and then ICU is there and then it just goes up again. Okay, so yes, so right now, and how I looked at this, I realized that at some point, when you do this, I'll have to take these walls off, like break this off. Let me zoom in for a little bit, show you guys. I have to take these walls off, and then let's see this, and also too, these rooms do come pre-built too, like right here. So if you come here, and then I think all the rooms are open. Uh, let's see, doctor's office, and we could actually do our own and everything. It'd be pretty much to do our own and everything. Yeah. So yeah, this is trauma center observation. I believe that's on. I believe those are the tabs for this right here. Okay, and then they have all other departments, radiology. Let me see. Radiology does not have a doctor's office. They only have like MRI, and it would be great to have another MRI and another CAT scan, because we do have a lot of people who go to CAT scan MRIs. And I'm thinking, like, if anything, we can get like just one for the emergency room. I'm thinking like maybe we can have like an MRI over here, like radiology over here too. So people who are coming directly into the emergency room, if they need an X-ray real quick or MRI, if that's available, they can just go straight in. Just to have something. But we'll see. Uh, I'm not recommending ICU here. I'm still recommending ICU still up here. I think is a great place for the ICU. I think making it bigger, like all this over here, having this as ICU, I think it'd be, you know, I hate to say bigger, but again, if we do have that, we have the room for more sick people. It's just that it's nothing wrong having a big ICU, or we could just name it CCU or have that as CCU, critical care unit, or ICU, intensive care unit. Uh, and then we can just work out, our oh, you know what? I just realized something. You see this, guys? Sonogram. What's in this room? This something. Okay, so this is the sonogram room. You guys see this right here? So let me just see something. See, I learn something new all the time. If we come here, right, in our general surgeon department, do we have? We do have a sonogram room. Where's that room at? Where's it at? Because it's telling us to hire or build. So it's saying that we have one. Hold on. Let me see. So would it be at nighttime? No, we have somebody there. Hold on, let me just see something. Okay, so they want us to build another sonogram room. Because here's our sonogram room here. And it says build and hire staff for one sonogram unit. So I'm thinking maybe they want us to build another one. And if we do that, we can fulfill this. Build and hire staff. Because right now, if we look at general, we have one here for day shift and night shift. So maybe they want us to build another one. So we'll build another sonogram room. But it's always good to know that we need another one. And I think as OMC gets bigger and robust, we'll have all these different things. But again, I'm not really sure if they're going to go up on staff. I think the limit is 200. So we just have to make sure that our doctors and nurses are in the right spot and in the right cubicle and area. So, so good. Okay, so now I see. Just like so. Okay, so yeah, so here's our sauna, here's our cardio. Let's see what this looks like. It almost looks just like the sonogram room. And then this is our diagnostics and our operating room. It's always good to have another operating room and hire more surgeons. This is our internal medicine department, orthopedics, cardio, neuro. And then I realized something too. They was like, you can actually like copy and then paste it and then have your own. You see your own prefab. So yeah, so again, I think that'd be great. So yeah, so just one step at a time. So okay, so let's go here. Also too, I added, let me see something. Because yeah, this is definitely going to be a construction more focus on patients. But we're definitely make sure that our clients, our check clients, our patients are well treated here at OMC. All right, so let me see something. Plus, also too, before I added on in this part here, you can go here and then I added that all the walls be put on automatically around foundation. Uh, okay, so just bear with me, guys. So let me see. If I come here and do this, nope, it would be. Oh yeah, I did read online where they said that if I was gonna delete something to get the money back, make sure I press something like over here, something like that. I'll have to rewatch that again. I think it was when getting your things. Like, let me see. These are all the doors. These are all the objects and stuff. Okay, so these. Okay. No problem, no problem. So I see that these are the top and the sign. Where do you keep the streets at? Like the parking for the ambulance at? Because if I like automatically, the maybe just they're just not gonna let you go that far out here. I mean, they let me do it over here. Okay, so what am I doing? Okay, so I'm trying to let's see. Let me see this here. Okay, so there was a wall behind there. Uh, what are we doing? Okay, so I'm adding foundation. No, I'm not adding foundation. I want to delete it. Delete. Yeah, so let me see. Yes, I want to delete this. Okay. Yes, because when uh when you add, okay, let's delete this too because I don't want it to be sloppy. All right, let's do that. That. Let's delete this. Yeah, because I'm gonna extend this all the way out. I'm gonna use up as much tile as I could possibly use up. Let's see. I think we can come all the way out here, right? And then come all the way up here. Right? Let's stop there. And then let's do this. And then let's do that. Okay, there we go. Okay, there's our ball there. Now, uh, where did we find the? Okay, so it was brick, right? So it was here. Nope. It was from here, right? And from here all the way down. Okay, that was not what I wanted to do. I wanted it on the other side. Okay, there we go. Is that inside? Is that inside? Okay, that is inside. Okay, so this looks like tile. Let me see. That would be the department. Okay, so let's see wood. That's hot in here. Let's see here. Okay, that looks good for a clinic, right? And you wouldn't have to even worry about these walls over here because these walls right here, you don't even see inside. It's just all about here. Okay, so if we do our floors, let's get some wood floors, right? Just like so. All right, up, up, up. And I know it's taking money out of the bank, right? Let's see, is it? Oh, no, it's not. Okay. So, now that this is open here, let's go ahead and go here, right? Because this is what we're looking for. And then we will come here and then we'll go to this department. So let's see what we have over here. We have offices, right? So these are doctor's office. So we can do a big one like that. I'm thinking these are the big ones. Let me see. Okay, some of them have the office in there, but we're just gonna keep the office. So how do you do this? We come over, rotate. Okay, there we go. Nope, we went the door this way. Okay, so let's see. We can just throw that right here like this, right? No, but I want the doctor's door like that. Okay, you guys like the doctor's door like that? Nice. Okay. Let's go ahead and do another doctor's office like so. But let's see this doctor's office. So we can get here, right? Oh man, I don't like the walls on that. It just throws the walls off. So if we come here, what walls do we have there? It looks like it's gonna be this one, right? Um, is it this one? Absolutely not. But that kind of looks hot, right? Okay, we could deal with that, right? Just have to realize it's this wall here. Okay, so let's go ahead and put another doctor's office in. Bada bing, bada boom. Okay, so wow, this is a bigger doctor's office. Like this is huge. Um, that's bigger than that one over there. Okay, so we can do it like that, and we can put it up like that, and then let's go ahead and can we put like a yeah, you know what? I realized that where is the restroom for so if they want to go to the restroom, where do they go to the restroom at? Okay, they all use this one, so they would need another restroom. It seems like it's in the lobby over there. Okay, so yeah, let's do this, that, right? What the hell? That's it? Okay. Did they actually charge us that 40? No, they're not charging you, Green. This is the mode where you could just build, and they won't charge you, right? I guess. All right. So Now, what can we put here? Can we put like a janitor closet right there? Yeah, it's like really, really high in here. And look, they have observation rooms. Can we put observation rooms down here too? Man, you can put whatever you want here, Kareem. It's your hospital, bro. That would be good to put an observational room down here too, in case like some of the patients can get hospitalized down here. That'd be awesome. Just to have it like right across the hall, like somewhere in this area. And look, it's already pre-made. It looks beautiful. Looks sexy. And let's see. So this is observational. So observational rooms could be like this or like that. And then like we have a trauma room that already has a stretcher. And our trauma rooms, let me see. Yeah, they are like that. Okay. Hold on. Before I do it, let me go ahead and bring this out like so. I have to do this, and I'm trying to break that in half, right? Okay. Now let me see what is actually here. So it's glass here. So I would definitely want to extend this all the way out like so. Like this. Yeah, we're gonna make OMC a nice hospital. Okay. And then we're gonna go ahead and come out here and do this. They're gonna be like, oh wow, look at OMC. OMC looks really nice. No problem. And we're gonna do this and this. And then we had this is already pre-selected for us. We're gonna come up here, bring it out like so. Uh, and see that's the thing. Is our clinic open now? It is open. Because I don't want to take them out and okay, so let's come over here and see what's going on at OMC. Alright, so let's see here. Let's see. Miss Lewis. Oh shoot, I didn't mean to do that. I meant to do this. Blood test, temperature, speech. We're gonna give you something for your pain. And see, should be a great candidate for like we can just switch over to observation and everything. Okay, so let's see what's wrong with you, Mr. Harris. Nope. Robert. Okay, we're gonna give you that. Nasal. We're gonna okay, Frank. Let's see. Cold blue, cold blue. Cold blue, cold blue. Okay, great job for responding to that cold blue. Okay, so he has this. He needs antibodies, and he's already on that, but he's not really having any type of red flag there. Okay, lab procedures came up something. Okay, we're gonna go ahead and okay, so you have that. We're gonna go ahead and give you this. And then we still don't really know what you have. It's 50-50. Let me see. You need that. This will need. You need the same medicine. Uh, let's go ahead and do that, and then give you your medicine. Okay, and she is one of our favorite patients. Okay, how are we doing at ICU? I'm like everybody. Oh, what's wrong with you? Okay, Miss Jackson. Looks like you're getting better. Because your satisfaction is going up. You might be getting transferred out of ICU. Okay, so who do you have here? Miss Gonzalez, you don't look like you're doing any good, but you are on your medicine and you are sedated. That's good. Okay, Mr. Martinez, you have this. You're not getting better. You're just 1.5, so feel better. And Mr. Wilson, you're on that right now. Okay, so feel better. Okay, it looks like someone just arrived. Okay, so they're doing surgery. Wow, nice. What's going on? Who are you doing surgery on? I'm trying to be nosy. Okay, so Miss Green is having surgery, fraction surgery. Nice. That's 2,800. Okay, so it's gonna go here. Oh, come on. Here. All right, who just came to OMC? Okay, so let's go ahead and do that. Oh, you have the same thing, Miss Young. And then I see one here. Okay, so Miss Harris, we know that you have abdominal injury. We're gonna go ahead and do the abdominal, and we're gonna do a physical. We're gonna do blood pressure. We're gonna do a CT, and we're gonna do a blood draw. Okay, Miss Young. I think I just passed you. Okay, right here. Yeah, so you're waiting for a bed. Let's see if we can just put you here. General. Okay, I'm gonna have to watch you. When a bed is open in orthopedics, I'll have to place you there. Matter of fact, let me see what's good down here. Okay, Mr. Lewis is collapsing. Cold blue, lobby, cold blue, lobby. Let's see. Let's see if those drills work. Cold blue, lobby, cold blue, lobby. Very good. Very good. Very good. You can tell Mr. Taylor was very active in response to that drill. Okay, so we have a patient, Mr. Lewis Claps. He's not out of the woods. He has 7 hit symptoms. And we're going to actually switch him over to the ER. Okay, we're just waiting for a stretcher, right? He's going to get a stretcher. Okay, so I think we're going to have to place some stretchers out here. There's nothing wrong with having stretchers right here or like right here. Put these stretchers like right here. Let me see. So they won't have to walk too far like over here. Maybe we can just have a stretcher there. Let's see if we can do that. Okay, so let's go. Cold blue ICU, cold blue ICU. Defib. Mr. Adams is having a heart attack right now. Oh, thank you. Thanks. Okay, so let's see if Mr. Adams could be shocked back to reality. He is having a heart attack right now. Okay, so it's been suppressed. Let's go ahead and do this so we can get more on his not possibility, but symptoms. Excuse me. Is he having surgery? Spleen rupture caused by impact. Okay, so he must. Mike was in a car accident and punctured his spleen. I may have to take it out of him. Okay. So it's 11 o'clock in the morning. And where was I? Oh, okay, I was down here. Alright, so let's see what's going on with you. Mr. Martin, I'm gonna give you something for your pain and your dizziness and also your redness. And we don't really know, but you're going to be waiting for a bed in orthopedics. I'm not going to do anything with you until we consult with Dr. Taylor. Okay, Miss Hernandez, we're going to give you something for your ankle and your pain and also for your tenderness and your joint. And we're going to give you some ointment, and you're going to be waiting for... Matter of fact, we can actually send you home with some cream. Okay, look like you just got up and walked away. Is that true? Okay, guess we'll just move on. Alright, Cole, yes, you are in pain. We're gonna use some ice, we're gonna use some pain, and we're gonna give you the something for your leg, the swelling and the tenderness and the pain. Dr. Taylor is your doctor as well, so you look like you'll be going to numbing cream. You might yeah. If we can do a cast, like as soon as possible, you can be on your way going home. All right, Miss Smith. Let's see. We're gonna give you ice wrap. We're gonna give you something for your joint and your swelling. You need some ointment cream too. You might be good at 12 as well. Depends on the treatment. And looks who's your doctor. You're in good hands. Okay, so Mr. Adams, you're waiting for a bed, and you have this, and you need surgery. Okay, so hold your line. All right, Miss Adams, we're gonna give you something for your pain. Is it serious? Yeah, you're definitely serious. Let's see. Is a condition where the heart comes. I mean, you may be a good candidate for ICU too. Let's do an EKG and let's do this. Yeah, I think we're gonna go ahead and send you to ICU instead of just sending you over there because they recommended. Let me see what your doctor. Let me see. Okay, so Miss Williams, Miss Karen, your patient. Is it possible that we can just go ahead and switch her into ICU because okay, she's actually going to here. Is that where you need to go? Okay, you do need to go there, but okay, so since you're going to be transferred to your room, we're going to leave you be, okay? Since you're there, you're not even on your floor. Okay, so let's go back down. All right, so you're going to go ahead and be transferred. We don't really know what you have, Mr. Williams. And Mr. White, orthopedics. I'm thinking there's a room available, but ICU. How are your symptoms? Are you suppressed on all? You are, but your pain is high. You're in good hands. Dr. Clemons is gonna do as much as he can to make you feel comfortable. Matter of fact, let me look at your satisfaction. Is it really up there? Okay, you're up there. You're not in the you're out of the woods, but you're not into. You'll be good. All right, so I visit all the patients here in the emergency. Did we have anybody in the ER? We do. Okay, this was Mr. Lewis who collapsed. Okay, we're gonna give you some for your rash. Okay, let the doctors try. We're gonna give you some steroid cream. You have typhus fever and you need some antibiotics. We're gonna go ahead and draw some blood. You have 4 symptoms, hidden symptoms: a rash, a dry cough, and chills. We're going to temperature measure, gastroscopic, and we're going to do this for you too. You're in the hearing of Dr. Baker. All right, and anybody else down here? Looks like, okay, we have someone over here. Harris, we're going to give you something for your pain. We're going to do a urine analysis and fast. And we're just going to rule out these possibilities of your diagnosis. Pancreas, transported to a room. Where are you going? Okay, you're going upstairs. Okay, it looks like somebody's being wheeled back in here. It could be, let me see, who are you with? Okay, Miss Harris is on her way back. Okay, wait. So Miss Harris is coming over here? Isn't this Miss Harris? Yeah, so you're going to be transferred over here to over here? What's that all about? Okay, is it something over here that you guys can't do over there? Okay, that was strange. Oh, you're doing a blood test. Okay, so we don't really know what's good with you. Okay, let's add that one in there. Okay, you're in good hands at OMC. You're in good hands. Okay, yes. So our mission is the hospital mission is getting these patients out. Oh wow, we just got $1,000 right there. Nice. Thank you. Come again to OMC. Take care of your problems. Okay, so it looks like there's mad beds available over here. Let's see what's happening with Mr. Wright. He will be definitely a good candidate for ICU. He's wheezing. Okay, let's see how. Okay, you're getting better. You're okay. You're getting better. Okay, no problem. Because I was gonna do you a favor and put you in ICU. You have emphysema and you're on the oxygen therapy. Okay, so you're hopefully you're getting better. But I've seen 2 stars. Okay, Mr. Cole, how are you doing? We still haven't diagnosed you. You have so many diagnoses. It's unbelievable. Yeah, everything has been suppressed. Your nausea and 3 hidden symptoms. Um, hmm. Like I said, I have to. Oh, thank you very much, sir. Thank you. Come again to OMC, Mr. Wright. I knew you were gonna get better. Nice. See, we doing something. Okay, so Mr. Cole. Okay, so we just let your medicine kick in. Wow, carbon monoxide poison. We might just switch you upstairs. Let's see. Okay, wait. Where's that patient that I had sent up there to TC? Miss Jackson, Patricia Jackson. You're still having wheezing. You're wheezing. Everything's been suppressed except this. This is low, but any tests being no. Okay. And here, Mr. Lewis, you have asthma, and you're definitely getting treated. Okay, no problem. All right, let me see who's over top of you guys. Okay, so it looks like we have some beds available over here. Hopefully. Barbara Jones, you have carpal tunnel syndrome, and you need surgery. Up, don't go anywhere. Let's see what you need, Mr. Jackson. Uh, you need vitamin D. Are you on it? Okay, so you on your medicine. We have a bed available. Let's see what's going on with Miss Green. You need surgery. But weren't you the one that was already in surgery when we seen you? I'm not really sure. Okay, so she's standing around. What you doing? Oh, you fired. So go home. Go home. If I fired you, go home. It says fired. What do I do? Send you to the day? Dismissed. I dismissed you. Okay, let's see if she moves in. Okay. I guess not. She just moved that way. Okay, let's do that one. Let's do this. Okay, now where you supposed to go at now? Yeah, so tell me if that's a bug or not. Alright, so let's see. If we select your department, would you go there? Nope. Let's see that department. Nope. Nope. Let's see. Let's rehire you. Can we rehire you? Okay, we just rehired you. What that mean? No. No. Nope. Okay, we take away your rights. Okay. And yeah. So you're just gonna be in that room. Maybe you might leave when yeah. Okay, are you leaving? Okay, no problem. Stare there at the wall. Okay, Miss Gonzalez, let's go ahead and do this for you. Nice. Thank you. Thank you for trusting in OMC. Alright, so let's see up here. Oh, wow. We have a lot of blood there. Janitorial to OR. Janitorial to OR. Housekeeping to OR. Housekeeping to OR. Okay, so let's see what's happening up here. Miss Wright. Miss Scott. Miss Jax Johnson, let's go ahead and do that. You are actually one of our favorite. Oh, okay. No, you're not the one. Let's see. Was it you? No. Okay, we can unfollow you. Okay. Was it you? It was you. So let's see. Can we go ahead and send you up here? Because that's where you need to go. All right. Who are you? Doctor? Nope. You're Pete Scott. Okay, so let's go to Mr. Wilson and see what it is. Okay, so it says that he has that. So what do we do now? He's being transported to exam. So we already know what his possible diagnosis is, right? Okay. She's home. Okay, they're just standing there like runny nose. And we're just gonna go ahead to Dr. Clemons. He has two patients. Karen. Okay, yes, Karen. Let's give you something for your pain. And we still haven't ruled out your possibilities of diagnosis. Okay, Mr. Williams, you're doing cool. Mr. White, you're doing cool. Wow, let's give you something for your pain. Let's order MRI. Here, sample and that, and we're gonna see if we can rule out those fractures. Let's give you something for your pain, and we don't really know what you have, but whatever it is gonna require some type of therapy. It's 50-50. Okay, let's see, nobody over there. Okay, so clinic is almost closed. That's what I wanted. I wanted to do that because, matter of fact, let's see how many people we have in our clinic, right? I want to see. Okay, we have 9 people in our clinic. Holy smokes! And we're about to close in a minute. Not a minute, but soon. Okay, so let's see, Mr. Adams, welcome to OMC. We don't really know what. Okay, you're being interviewed. Okay, Adams interview. Okay, you both named Adam. Okay, your name is Alan. All right, who's here? Mr. Scott, nothing. Miss Clark, let's go ahead and give you something for your pain, for your nausea, your red eye, your blurriness, and some eye drops. And you need to go to neuro. So if we can transfer you to the waiting room, do that and that. They might have to hospitalize you. Let's see what Dr. Martinez says. I think that was Dr. Martinez. Okay, so let's see. You have legionnaires disease. Let's send you here, and your red flag up. Let's go ahead and do this, this. And you might need to go to hospitalization because you're here. Let's do that. ICU. I'm gonna go ahead and oh, you don't even have a doctor. Let's switch you to Miller. Miller, I'm gonna call him on the phone. Miller, you have a patient coming up there to internal. I think she needs to go into ICU. If anything, let me know. I'm gonna follow you. We have a patient collapsing. Mr. Adams. Cold blue ICU. Cold blue ICU. Wow, that spleen is getting you. He needs to be shocked. Fast. Okay, what's wrong with you, Miss Jackson? You're just being laid out. You're just out on the bed. Okay. What's up with his shock? Is he being shocked? Was he shocked? Okay, Mr. Wilson was shocked. Okay, he's been shocked back. He's what's happening over here, Adams? He's been defibbed twice. Okay, that was my fault. It wasn't that patient, it was this patient. He's been shocked. Wow. So hopefully we don't lose him. Let's star him. Okay, so. Oh, you're still here. What's going on with you? You're waiting for Boston Brace and let's see, rest. Okay, so you're good in Mr. Walker's hands. All right, so let's come over here to this waiting room and see how many people we have here. It doesn't show. Oh, we have 1. So let's see, who's here? Who's here? Who's here? Okay, right here. Wow, nice. He just paid a whopping $240. Oh man, Mr. Adams died. Wow, being jolted 2 times. I mean, I wouldn't blame you. Let's see. I'm gonna go to him in a minute. He just died. Unbelievable. Okay, so we don't really need to order all these tests here. We know what you have, and you're going home. Okay, so Mr. Adams died in ICU. Apparently, it's very unfortunately that when a patient that comes here to OMC, we try to do our best and care. Unfortunately, we can't really do it as all we can't really save, or we can't really do, because here it says forehead and symptoms, and maybe that was causing his heart failure, because he had this. And see, that's what I'm saying. If I had an OR here, because I do know that they have an OR for ICU or something, maybe we could have got him there as soon as possible. But unfortunately, Mr. Adams died, and you know, it's sad when we lose a patient at OMC. Very sad. Okay, so yeah, and see, that floor is bigger than there, so it just shows we can make that floor really wider. And I'll do that offline, and all this here, and add all this. Yeah, okay. So I'm thinking that, okay, so our clinic is almost closed soon. I'm thinking, since, okay, somebody just paid something. Okay, look right there, $80. It looks like Dr. Walker is doing his thing. Okay, yes, that's what I'm talking about. Nope, that's the bathroom. All right. Oh, whoa. Okay. Boom, boom, boom. Bada bing, bada boom. You have hay fever, and you're gonna be good. Let's see what's going on with you, Mr. Barker. You're here. Let's do that. You have laryngitis. Where do you need to go? Oh, you just need some antibiotics. Who else is in here? Okay, nice. $400. We doing something today, Throwback Thursday. Okay, Mr. Gonzalez. We don't have any rooms in high dependency unit. Okay, you're still here, and you're waiting for a bed. Let me go up here to I am, see what's going on. Okay, so you need a bed over here. That's where you need a bed at, because they're not gonna put you in here. Can somebody go home here? Okay, you look like you need to go to ICU. Let's switch you to ICU. I'm gonna go ahead and switch you to ICU so we can bring up this patient here, so he can get out of the ER. And this is our own private room. Let me see. Is this a private room? Private room? Private room? Yep, this is private room. All right, so we're gonna go ahead and get you up there, because you look like you need to be in ICU. And I'll talk to your doctor. Let's go ahead and do that surgery for you. Let's go ahead and okay, you have cystic fibrosis, and that is something with the lungs. Hmm? Oh, yeah. Okay. So somebody will be transporting you there soon. What's going on with you, Miss Lewis? Looks like you have asthma. Okay, Patricia Hill. Treatment for Patricia diagnosis not available. Blood transfusion. Make it happen quickly. Okay, let's how do we do a blood transfusion? Let's do high dependency, and then we'll make it happen by seeing if we can do a blood transfusion. Okay, matter of fact, there we go. There you go. Get better. All right, so let's see what's going on with Mr. Jones. Let's go ahead and do that. Boom, bada bing, bada boom. You're insulin, you're diabetic. Goal. No. Yep, I know. You'll get better when that insulin goes right through your veins. Okay, so let's see. There we go. Knew it was something wrong with you. Let's go ahead and do that. You need this. You need a blood transfusion. Let's go ahead and HDU, and then eventually we will give you your blood transfusion. Okay. Yeah, you guys. This is a unisex bathroom because male and female can go there. Hey, let's give you IV and let's whoa, you have Lyme disease. We're gonna suppress that rash, that fever, and that fatigue. We're gonna go do a chest, and we're gonna put you in high dependency, and you have this here too. Ouch. Let's watch you. Okay, we're gonna go ahead and do that. Oh, nope, 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 nope. I don't want to do that. Thank you, sir. I want to go ahead and order some more tests on you first before we actually Miller make that call. I just want to go ahead and add some to tests for you. Okay, so yeah, there's no one here. How many patients do we have? 0. And look, our clinic is about to close, right? It's 1957. Okay, yeah, I'm not really sure why that nurse is still over there. Okay, did I pay? Okay, you still did not leave. What's up? You still didn't leave? I thought we made it available over there for you. Waiting for bed. We we made it available for you, right? What's the bed you? Okay, patient is collapsing. Cold blue, cold blue, cold blue, cold blue. Actually, put her on heart monitor. We don't really know. I want to say. Wow. Chest pain, fatigue, breathing problems, heart failure. Wow. Tuberculosis, lungs, tuberculosis, myocardia, anticoagulants. Let's go ahead and do this. Let's do an X-ray, MRI, an eval, and a CAT scan test. Maybe they will rule out the possibilities. Wait. Okay, where was that patient at over here? That was in that room all by himself. Okay, he's out. Who's coming over here? Who's getting this room? Mr. Lewis. Were you just in the ER? No, that wasn't you. It was you. Okay, so yeah. Nice. Alright, cool. He's been transported to his room. Okay, so it looks like our emergency room is clear. Okay. Dr. Clemons is doing his thing. Right over there. Where's she at? Upstairs? Sure enough. Okay, so seems like our clinics are about to close. Let me see. Anybody over here in this clinic? Not really. Let's go upstairs and see if anybody's over here. Let's see if our prestige has gone up. 81. Okay. Doesn't seem like anybody's over here. Anybody in the waiting room over here? No, come over here. Thank you. Okay, no. Okay, let's see what's going on. Patient is collapsing. Let's go. Cold blue, radiology, cold blue, radiology. Okay, let's do this, dialysis. You have kidney disease, heart failure. We call the cold, right? Is it cold? Okay, there we go. Whoa! Please get onto this. Okay, thank you. Please get onto this. Yeah. Oh. Wait. Are you about to... Okay, Miss Wright, hold on. Let me see. Are you about to clean this, ma'am? Oh, because this is not... Since this is not a opening, they're not going to clean this. So... Oh, boy. What room can I make? Can I make this the waiting room too? Because they need to clean this. Let me see. Can I can't. How do we do this? Staff only area. Patients must have permission. Free area. Okay, so no, let's do this. No. No. What's this? Restrict area. Oh boy, that's not what I wanted. Do you still clean? Restrict area for all patients. I don't want that. Ching. What do we do? How do we get rid of? Remove room. Okay. What the Okay, there we go. Okay, boom. Free, but I want them to clean this. I want janitory to clean this room. Waiting. Okay, let's do corridor. Can we do that? Okay, that's a corridor, right? Okay, so I just want one big one. Let's do this again. I want to remove. Okay, and let's see. Corridor. Let's do this, and this come out like this. Because they need to clean this. There's a corridor, and then we just might need to have all these corridors. Okay, there. And there. And there. Yep. So now they can clean this. Because this does not look good at all. That looks disgusting. Okay, who's coming over here? What's this? Who's this? Mr. Allen. Let's give you that. And you're going to orthopedics, I believe. Well, you probably haven't something done. All right, so yeah, and I do want to apologize for the stream going so late because there was a blackout, a power outage in my area. So wasn't able to do it. Cold blue, cold blue. 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 Here we go again. Cold blue, cold blue. Man. Cold blue, cold blue. I'm gonna go ahead and put out ICU. I can't believe it. I don't know how many times I called cold blue and she's gonna need to it's okay, maybe it wasn't like, was she shocked? No, it wasn't like she was shocked. Okay. Okay, we had another patient that was collapsing too. Okay. Where you at? Okay, you're in the elevator. Let's do this, 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 this. And you need to go to cardio. Okay, you're anyway ICU. Yeah, I called somebody. All right, clinic is about to close. Once when clinic close, I'm gonna go ahead and do all this, so these doctors could be out of the way. I don't want to mess with them while they're there. Okay, so are you guys getting better? We still don't have a for that. Okay, you just paid us $900. Thank you very much. Up, look like night shift. Okay, boom. Look like they're going home. Looks like a change of shift. Thank you very much. Please take this time to follow the drill. Cold Blue manual books. We call it Cold Blue. We provide all doctors and nurses to follow those protocols for Cold Blue, Cold Yellow, and Cold Red. And Cold Black, which we will have an evaluation done real soon on that. So you guys have a great night, and we'll see you guys tomorrow. All right, so let's see, just like so. So now we can do all this over here. What I want to do real quick online, I want to come here, and then what's this? Delete walls, right? I want to delete all this, right? Just like so, right? And then actually I want to delete this too because I'm going to extend all this out. So let's do that all the way over here. And then let's do foundation because we want to use as much space as possible. Yes, it is very hot in here. Oh, we all the way out here. Oh, yeah, that's good, Kareem. Okay, so we're gonna do all this like right here, just like so. Let's do it there. Thank you. Thank you. Thank you. Okay, so let's do this. Okay. Now I'm gonna go ahead and do these walls. Nope, that would be inside. What walls do we have? Was it this? It sure enough was. Okay, so we're gonna come here, do it like that. And then okay, so let's see. What room is this? Sorry. If I come here and open up, this looks like our stat lab. So if I was to go ahead and what's this? Remove room. Let me see. Okay, so the question is, do we have a stat lab here? I'm sure they do, Kareem. On call. No, they don't. Where would you find a stat lab? Would it be in radio? What's this? Reception. Okay. Um, this would be a great time to use the prefab thing, right? So how do we do it? Okay, so copy. What's this? Okay, let's do this there. Let's take this just like that, right? And then we want to move them like right here, right? Can we do that? Wait, hold on. Why is it wait, can we do it like right here? The is not allowed at the activated department. This prefab is not allowed at the activated department. No? Um, why wouldn't it be? That's because, oh, look, right here. Okay, no problem. So, okay, so let's do this. Remove room. Wait, before we do that, let me see something. This looks just like that, right? Let's see. Yep, it does. As the okay, hold on. And it just has like three of them, like three rooms. Okay, stat lab, stat lab. Okay, cool. So we could actually have the lab right here, right? How do you rotate? Okay, like this. Let's go ahead and put this lab like right here. Okay. And then we're gonna do the walls back to where it was, right? Like that, right? Then we're going to delete this. Come here. What's this? Bulldoze walls and objects? Nope. 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 Remove objects, keep walls intact. Yeah, let's do this. So, no, I want to delete the whole thing. Delete walls, no. Drag, retain, no. Build walls, no. Bulldoze walls and objects. Yeah, let's bulldoze walls and objects. Okay, so let's do this. Let's do that. Okay. Oh, we get that money too. Okay. Now we need to how do we do that? Is this, right? And then we need to let's see, restrict. Let's do this. Can we do this? Nope. This? How do you bulldoze a wall? Let's see. Is this it? No. No. Okay. So I want to. I don't want that room. I want to delete it. Okay. Yeah. Yeah. Once when I know how to do this, then I'll be able to be free. Can we just do this and then remove? Okay. Thank you. We were able to do it. Now, is there something here? There is. Okay, so let's come here and let's do that. Why can't we delete this? It's being used? Wait, somebody using it or something? Oh man, I can't delete this. Bulldoze. Nope. Let's see. It's not going to let me delete this green stuff. This is object. Nope. Nope. Okay. So let's do the floors. It was wood, right? Like that, like that. That's the wrong one. Okay. That was the wrong one too. What do we have? Would this be better? Black floors, yeah, that looks good. 11 black floors. Okay. Yeah, I'm not really sure why I can't delete that stuff there. Okay, so do we have our lab there? Okay, so we do have our lab there. If we come here, it does tell us we have a stat lab. Okay, so we're gonna add another one here. Mm-mm. Okay, and what do we have? 3 right there. All right. Maybe eventually those pieces will move, because I don't know why. Right? Uh, I just don't know. Oh, because maybe they belong to something? I don't know. All right, so let's do this. And we see that that's the corridor. Okay, so what is this? 1, 2, 3, 4. This is a bathroom. So what I'm gonna do is I'm just gonna go ahead and remove rooms and do like this. Yep. Okay, 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 okay. And then can we just delete everything in the room? Here. Yep, so let's do. Yeah, I just don't know why we can't get rid of this. I don't know why we can't get rid of these two things. And this chair here. Oh, because they're using it? Now can we wait, are they gonna go use this stuff and then we can delete it? Let me see. Can I delete this chair now? Oh, yep, I think they're gonna go use it. He's gonna come here. You're gonna sit down. Okay, can I delete this stuff now? Okay, somebody's about to use that chair, so let's speed up, right? Oh, you was gonna use that chair. Oh, goodness. I gotta wait until you guys use this stuff now before I delete it? Unbelievable. Okay, so come back here, do the floor. This part of this hospital will be open. Alright, so let's go ahead and do this real quick before I end the stream. Alright, I think that's our elevator. Okay, so what do we have here? We had 1, 2, 3, 4, 5, 6 doctor's office, right? So let's do this real quick. Okay, we have 1, 2, 3. We had a lab, and then what is it recalling for? We need a waiting room, and we need doctors. Okay, so let's go ahead and come back here, and let's go to a waiting room. We need a big waiting room. Let's see how this waiting room looks. That's for that. That's like that right there. Okay, so let's see. What is this? That looks like... Okay, let me see what this looks like. Well, we can have that because they're gonna walk in here and go in here. But let me see something. Okay, that's reception for this. Okay, so... And the corridors are what? Mark corridors or room type to assign area, equip department, and enable lights. Janitor clean, I knew it. Okay. So, okay, so we're gonna do this as a corridor, right? Because we want them to clean over here, right? This is a corridor. We have the matter of fact, let's go here and do walls and then do this like that. Let's get the back of this department. You come up. Eventually I was gonna extend this out. Oh wow. What can we do on the outside of here? Let's just have plain white walls. Can we just have plain white walls? Okay, let's do this. Let's go here and go all the way out. How'd that look? Looks boring, Kareem. Let me see. Can we have black to match our floors? That looks like a corridor. That looks disgusting. But it matches our floors. Okay, so let's do this. Let's do this. And do this. That. Alright. So let's build that up. But then that's gonna look. But this is outside. Okay, so cool. So we need to have a corridor come in here, but eventually I'm gonna take this off and just have that, because this will be considered our lobby. And then they walk in here. Okay, so I'm gonna go ahead and end this stream right here. Eventually when you come back here, you will see what I've done so far with this. It's gonna look amazing. Okay, so you guys, thank you so much for being here on Project Hospital. I know our hospital looks crazy right now, but trust me, this hospital will look fixed when this stream comes back on. Thank you so much, and I'll see you guys very, very soon. You guys have a good night. All right, happy Friday to you guys, and I'll see you guys soon. Take care. Bye-bye.